Okay, so let's have a look at idea, concern, expectation. This is a very, very important mnemonic, ICE. Idea, concern, expectation. This ICE can be used in all the scenarios, right? But we should be aware how we should use this ICE in our consultation. ICE, whenever you are going to disclose something, say cancer, it is very uncomfortable or difficult for us to say to someone, you might have cancer. But if you do ICE, I'll tell you like how it should be done. If you do it through ICE, you will see you won't be feeling that much uncomfortable, and patient will also not take it as a big shock, because we are going to disclose it in layers, and we disclose it after assessing the knowledge of the patient. Because whenever any patient is coming to us, they have got some symptoms and they must have checked it online that what's the problem they might be having. So they might be having some idea in their mind. So before we tell the diagnosis, it's always better to get their ideas, to get what are their concerns, to get what are their expectations when they came to us, right? So ICE. And also, like when we are disclosing bad news, breaking a bad news, this ICE is really important, right? And actually in all the scenarios in medicine, surgery, gynae, pediatrics, before you disclose the diagnosis, make a habit of doing ICE. Right, so let's see, idea, concern, expectation. What are the sentences, lines you can use when you have to do this idea, concern, expectation, ICE? Ideas. So, you have taken the history, you have got some positive points from the patient. So ask the patient, if patient has got any idea about it. Do you have any ideas as to what is going on at the moment? John, you have told me you have got cough, you have got blood in your phlegm, you have got weight loss, tiredness. Do you have any idea what's going on with you at this moment? I'm just giving an example. What happens when you're putting all the positive findings like cough, like blood in the phlegm, like tiredness, like weight loss in front of the patient and ask him, do you have any idea? Patient might be telling, doctor, is it cancer? So you simply have to say, this is one of the possibility and we need to investigate it further. That's always very important thing. Because if you simply say you might have cancer, it is something like very much shockable for the patient. So we need to buffer it, we need to put some space, we need to give some time to the patient. Right. So do you have any idea as to what is going on at the moment? Tell me about what do you think is causing this problem. So patient main problem is, say, doctor, I've got back pain, and we are thinking it might be prostate cancer, considering patient has got tiredness, patient has got weight loss as well. So we can simply, like, patient is very much worried about the back pain, and you can simply ask, tell me, what do you think, what's causing the problem? Doctor, maybe it's simple, sprain, back sprain. Yeah, it might be. It could be something serious as well. I mean, again, it's the same way you're checking the idea of the patient. Tell me about what do you think is causing this problem. Do you have any theories about what might be going on with you? I'm sure that you have given this a lot of thoughts, and it would be helpful to hear what you think might be going on. What do you think might be happening with you? What we are trying to make two-way conversation. What we are trying to do, we are trying to involve our patient. So that is very important. When you do this consultation, it's always very good idea to have the patient idea in the consultation. What they think, what's going on, or what might be going on with them, why they have got these symptoms. So ask about the idea of the patient. Right, so that's your ideas. Then we have got concern. We need to know, like, what are the patient's concern regarding this particular problem? Like, what's the biggest worry at the moment regarding what this might be? Because, when you asked about the idea, like you have got cough, you have got blood in your phlegm, you have got weight loss, you're feeling tired. Do you have any idea what's going on? Yeah, doctor, I mean, it might be simple infection. Right, it could be simple infection as well. But what's your biggest worry at the moment regarding, what it can be? Are you concerned about anything in particular? What we are trying to do, yes, we are making our patient a bit anxious, but we are trying to break it in layers. We are trying to get the concern. We are trying to get what is the worst thing our patient is thinking regarding this problem, right? Are you worried about this being anything in particular? In your darkest moment, what do you worry about? What's the worst thing you were thinking it might be? Are you concerned about any particular thing? So that is what we are saying is concern. We are just checking the concern of the patient. Right. And then we have got expectation as well. We need to see what are the expectations of our patient regarding the problem that he or she is having. Like, what were you hoping that I would be able to do for you today? What do you think might be the best plan of action? When patient is coming to us with back pain, I know we are thinking it is prostate cancer, we'll be doing all the investigation regarding prostate cancer, but ask the patient, what's your expectation? Maybe his expectation at the moment was painkiller because he's in severe pain. So that's something very, very important. What you were hoping would happen today? Yeah, doctor, I was just thinking it might be simple back sprain, but now you're telling me it might be cancer as well. I just came because I was only expecting that you will give me simple painkiller. Right. So what we are getting, again, trying to make two-way conversation, trying to involve the patient as much as we can. You're obviously thought about this quite a bit. Did you have any thoughts on the best way we could tackle the issues? Is there anything else you were hoping that I can do for you? What we are trying, we're just trying to involve the patient. Right, we're just trying to involve the patient. It is a cooperative approach. What do we understand by cooperative? We are trying to get the idea of the patient and we are giving our option as well. Doctor, patient, both are telling what can the treatment plan, and then we agree on the best plan of management. Right, that is what we do. We are doing a cooperative approach. Sometimes we do, not now, actually in the olden era, you can say, we used to do paternalistic approach where doctor is telling that's a treatment plan and patient has to follow. Still it's happening in a lot of countries, but not in the UK anymore. Here we are usually doing cooperative approach where we are discussing the things with the patient. And patient also has got his opinion, patient has got his or her expectations, and doctors will tell them the pros and cons of every single treatment. And that's how we will come up to a best treatment plan. That's the expectation, right? So what we are doing, we are checking the idea of the patient regarding the problem, we are checking the concern, and we are doing expectations. This is really, really important topic, idea, concern, expectation. You can use it in lots of things. You can use it in any medicine, anything. I mean, for example, patient has got a problem. It's a station of smoking cessation, just giving you an example, and patient is very adamant and doesn't want to stop smoking. But when you're taking history for smoking, patient told you that I used to smoke 4 packets, but now I'm smoking 2. Ask the patient before that, tell me, why did you decrease? Why did you cut down on your smoking? You said you used to do 4, but now 2. What was the reason? Do you have any idea, why you did this? And do you have any idea what this smoking can cause in your body? And then patient will be able to understand what doctor is really want to say. If you want to have good two-way conversation, make sure you're using this idea, concern, expectation. If it is simple history taking station, you can do it just before you disclose the diagnosis. Again, there is no hard and fast rule that you have to disclose or you have to do eyes only at this particular stage. You can do eyes anywhere you want. For example, patient came to you and telling you, doctor, I'm coughing blood. Okay, you can do eyes there and then. Okay, John, do you have any idea what's going on with you? Doctor, I'm thinking it might be lung cancer. I can see you are worried. I can see you are concerned. But let me ask you a few questions to get into bottom of this problem, and then I'll discuss what's happening with you. Tell me what else you have got with this cough in blood. Sorry, blood in cough. Or what else you have got with this hemoptysis, that is blood in cough. So that's how we do it. And you can do it any way you want. There is no particular area where you do eyes. You can do wherever you want. But if it's simple history station, I would say before you disclose the diagnosis, you can check the idea of the patient. Do you have any idea what's going on? So maybe patient will help you out in coming up to a diagnosis. Right, and make sure you don't forget about this eyes in Breaking Bad News. It is must there. Right, only then you will see you're able to do a good consultation or a good counseling of the patient. Right, so that's our eyes, idea, concern, expectations. Thank you.